see quite a bit of them
MOH,
coming
yeah.
in. I mean, not beauticians itself, but patients. I've seen a beautician,
Yes.
and the common factor is that they don't fit well. They don't fit well. They're not placed. They're not done well. The fillings, the area is always leaking with something. There's bugs behind it, and it's often a matter of too much. It looks nice, but at the cost of biology.
Yeah, I think the problem with beauticians doing the veneers is that they are not trained to do so.
But I think that also at the same time, they are just doing it at their like a place where it's just not meant to do these procedures.
Yeah,
right?
and also a danger I would say is that they don't realize they are doing actual harm, because it's I think a lot of people might think of it as something temporary.
You just paste it on, right? Yeah.
Yes, and then you could remove it anyway.
That's what I get also. Yeah. So I get really young people, and they pay good money for it, and they paste it on and say, hey, I can just go to the dentist and remove it. The problem is that you can't really remove it and without damaging something, right? So even if I'm going to drill the teeth, drill the filling off, drill the veneer off, it takes a lot of time because I will do it under microscope to really look at the floor in fluorescent lighting to identify where these veneers are.
Because it's the same color as the teeth,
so
yeah.
hard. So it takes me a couple of hours just to remove them very nicely. But even then, even if you take under high magnification of like 10 times magnification, I'm still going to damage the tooth a bit because you never know when to stop until you see the tooth.
Yeah,
right.
It's a bit like if you have a clean thing or a new thing, and then you put some super glue, and then you try to remove it. No matter how high you remove, there will be some kind of
mark there. It's not like one of those cool 3M ones that you can just peel it off. But still, it's still going to damage the surface. You might damage the paint away.
Exactly.
And so, unfortunately, it's not a reversible thing. Now, once you remove the veneers, which I often do, what happens is that maybe the threshold is like, hey, the damage is not that bad.
I think the other problem with the damage, it is the damage that you have on the tooth. The other problem is also when it's there, and like you said, it's often not placed well, like without a seam and things like that. Usually there's some kind of leaks, there's bacteria being trapped in there and things that you cannot brush away or floss away. Then it's trapped near to the gum, and then the gum suffers because the gum can respond to that bacteria being trapped there, and they often start to be inflamed, right?
Yep.
So they get affected by it, and these changes can be permanent and irreversible.